Welcome back to Emergency Chaos, where we provide tips and tricks to help you become a better ER nurse. Today, we are going over a key piece of advice and going into 7 questions to help you learn and check your knowledge. Thank you for watching. So, for the first tip of advice, it's going to be okay to feel overwhelmed. There is a lot to learn in the ER, and it's not going to happen overnight. It takes around 3 months for the anxiety of working in the ER to start going down a bit. It's not until 6 months into it that you're going to start feeling a little better, but you're not going to feel remotely confident or even at least less anxious or stressed for at least 1 year of being in the ER. I say this so that it puts it into perspective for you, so that you're not putting too much pressure on yourself and that you're instead focused on building a solid foundation little by little. So keep this in mind. When you start feeling overwhelmed, it's completely normal. And to help with this feeling, you need to review and build on your knowledge daily on your days off. So have a small notebook to take to work and take notes on. On your days off, review your notes, look up questions that you may have had, make a guide for yourself. For example, if you had a GI bleed, make a guide. What did you do? How was the assessment? What labs were ordered? What radiology was ordered? What about the meds and the treatments and so forth? This will ensure that little by little, you're building on your knowledge and foundation as an ER nurse, and that by the next time you have a similar patient with similar symptoms, you're going to be prepared because you made a guide that you've been reviewing, and you took the time to learn the things that you needed to learn. It's this accumulation of knowledge and reviewing that will allow you to feel better. And by the time that 1 year comes around, you're going to notice yourself less anxious and more confident because you've done your part in preparing. So now let's get into some questions. What is going to be the reversal agent for rocuronium? So let's say a patient with a head bleed was intubated, and now the neurosurgical team wants to reverse the rocuronium given during the RSI so that they can get a good neuro assessment, right? So they want to reverse it. What is going to be the medication used to reverse rocuronium? So the medication is called Sugammadex. Pretty sure I'm saying it right, but that's the name of the medication. It's going to be ordered to reverse the rocuronium or vecuronium if that was given for a separate thing. But again, for RSI, we're only doing typically SUX or ROC. And if ROC was given and they want to reverse it, this is going to be the medication used to do so. For the next question, how does CPAP help with oxygenation and pulmonary edema? Let's say a CHF patient is struggling to breathe and would benefit from non-invasive ventilation. How does CPAP help? So, CPAP stands for continuous positive airway pressure. It means that at all times there is forced pressure going into the lungs to help open up alveoli and keep these alveoli open. This ensures that the oxygen we are administering reaches the alveoli and gas exchange occurs with the bloodstream. This is called alveolar recruitment. This pressure, it also pushes the fluid inside the alveoli back into the bloodstream. Now, what can a high BNP indicate? For example, let's say your patient arrived with increasing fatigue, with activity and worsening swelling and edema to the lower extremities, and they're just more tired than they normally are. What would the BNP help us check for? It would help confirm if this is a congestive heart failure exacerbation or new onset heart failure, right? So in patients with heart failure or CHF as well, the ventricles release BNP when they undergo excessive stretching from fluid accumulation and increase in pressures. Now, what is the key treatment for ventricular fibrillation and pulseless ventricular tachycardia? What treatment is the most effective in getting these patients out of these rhythms? Defibrillation. So the high energy shock from defibrillation stops all electrical activity within the heart, giving the SA node a chance to take over again and produce a coordinated rhythm that hopefully also has a pulse with it. But bottom line, defibrillation resets the heart, allowing it for starting again and hopefully producing a good rhythm that produces a pulse. And then just super quick, if you want to continue learning and building a solid foundation, please check out our book on Amazon or check out our online course. Links are going to be in the description or in a pinned comment. So for the next question, what are the key medications used for hyperkalemia management? Let's say your dialysis patient missed their last 2 dialysis and the potassium comes back at 6.8. What are the key medications given while we wait for dialysis to be set up? The first medication is going to be calcium gluconate. It doesn't lower the potassium, but it helps stabilize cardiac cell membranes from the effects of potassium, right? Insulin helps drive potassium into cells, while dextrose helps prevent hypoglycemia from insulin, right? And then acidosis drives potassium out of cells and into the bloodstream. By giving the sodium bicarbonate, we help assist in shifting potassium back into the cell. Lokelma or Kayexalate, whichever medication your facility may have, binds potassium in the GI tract and allows it to be excreted via stool. And then albuterol helps drive potassium into cells, while Lasix helps excrete potassium in the urine. For the next question, why is aspirin given early on in patients who have a STEMI? What does aspirin do? Aspirin is an antiplatelet that helps prevent the blood clot from getting bigger and therefore prevents the worsening of perfusion to the heart cells. And in case you ever hear this, what does B52 mean? What does it stand for? You'll typically only hear this when it comes to violent and aggressive patients. So again, what does B52 stand for? It stands for Benadryl 50 milligrams, Haldol 5 milligrams, and Ativan 2 milligrams. These medications may be given together when patients are violent in order to help calm them and to help reduce their agitation and their psychotic symptoms.